We are honored to be joined once again by Tara Dowdell, who is founder and president of the TGD Speakers and Tara Dowdell Group. Good to see you, Tara.
Thank you, Steve. Thank you for having me again.
Well, I want to talk specifically about this particular initiative. We've collaborated with the New Jersey Economic Development Authority, Tim Sullivan and the team there. There is an initiative they're involved in with you and a couple of other organizations, 3 organizations that will enhance the effort to aid minority, women, and veteran-owned businesses. Talk about it and why it's so especially important right now.
So this is really exciting work, and we're happy to be a partner with the New Jersey Economic Development Authority. So the New Jersey Economic Development Authority has been rolling out a lot of funding programs to support our small businesses across New Jersey, and they're focusing on 25 employees or fewer, and they are also prioritizing women-owned businesses, minority-owned businesses, veteran-owned businesses. And why this is important is what has happened from a policy perspective with a lot of the programs that have existed, PPP, is you're asking businesses with 5 employees, 10 employees to compete against a business with 400 employees. And so what these programs are designed to really help the businesses who need it the most, who are often locked out of these larger programs at the federal level. And so it's been really exciting. And then the emphasis on ensuring that we reach the minority businesses, the women-owned businesses. These aren't businesses that don't work hard. These aren't businesses that don't contribute. These are businesses that revitalize some of our distressed communities. These are businesses that employ people who might not otherwise have an opportunity. These are businesses that add value, healthcare, education, et cetera. Sure. And so ensuring that they are valued and are given that access in a way that's usually reserved for larger businesses is really something tremendous that the state's doing, and we're helping to market.
So Tara, I'm going to be clear. Is the Economic Development Authority providing loans, grants, what?
So it's an array. So they have some grant funding. So the most recent program that they undertook were grants up to $10,000. So they did not have to be repaid. And they're also rolling out some loan programs that are forthcoming, again, focusing on the micro businesses, the true small businesses. And that's where you actually get the growth from. A lot of people think that the bigger companies is where the growth comes from. It's actually these smaller businesses. So the fact that we're having public policy really focus there, it's good for all New Jerseyans. And so they've engaged myself, and they've engaged 2 other agencies, women-owned, minority-owned agencies, to do this outreach to ensure that it's done in a way that's very inclusive.
I want to clarify. So it's 360 marketing and PR.
Yes.
And also Medina equals city, is that right?
Yes, Medina equals city, which is located in Newark, my agency in Jersey City, and then in Camden, 360 Marketing and PR is located in Camden. So we've really covered the state.
Absolutely. Tara, let me follow up on this. It's interesting to me. So our not-for-profit production company, the Caucus Educational Corporation, affected by COVID-19 in terms of sponsorship, in terms of the way we're broadcasting, not in the studio, et cetera. But also, that I do leadership development, communication, training, et cetera, in my other life. And that business is affected, hurt, changed, et cetera. However, in listening to you, what I want to follow up on is this. So I'm affected, you're affected with your business. Other women and minority-owned businesses, veterans affected as well. Do you believe with COVID-19 to date, as we tape this in mid-July, that you're affected differently and worse?
Yes, I do. I do think there is a disparity. And because, first of all, we already know from a health standpoint,
that's right,
that myself as a Black American, I'm more vulnerable. We are
social determinants, excuse me for interrupting, social determinants of health. Again, something Micheline Davis has talked to us about, and others. But that's a piece of that's the health equation. Go ahead.
Right. But I have to be more careful, right? I have to be as a Black woman. I mean, even the infant mortality, the maternal mortality rate, that's another big issue. I'm despite, and all of these issues, remember, for Black Americans, it actually supersedes whether you what your income level is, your level of education, what neighborhood you live in, how great the hospital is in that neighborhood. There is something, we are that we're less likely to be given as much pain medication. There's a lot of issues there. There's bias within our healthcare system, and the data bears it out. So I have that concern to worry about. I have an immunocompromised mother, so I have that concern to worry about. And then on top of it, I'm already in a good environment. I have my value as a business is often just I'm subjected to, we see it's equal pay, right? I'm subjected to that as an owner, right? In the same way that I, as a woman, just a woman period, I have to deal with the headwinds of people wanting to pay me less. When you add the fact that I am a Black American on there, and that so many people have internalized stereotypes, and then they project those stereotypes, that comes to the negotiating table every time I sit down.
Just because I offer a service with our communications company, you offer a service, same service. You offer the same, if not better quality. You're likely to be paid less.
I am likely to be paid less, and the data bears it out. I mean, if you look at even angel investors, right? This is why
Yes.
this funding that the state and that the NJEDA is doing and that Governor Murphy is doing, this is why it's so important. You look at, the access to capital piece. I mean, there are so many Black women-owned businesses who can come to the table, and they did a test. They tested the banks in California. It was a big study that was done, and they sent people in with equal qualifications, and some were slightly better. And the Black businesses were not likely to get the loans despite having equal or better qualifications.
That's like business redlining.
Testers.
That's like business redlining.
Right. And the testers went in, and this is what the data showed. You can't argue with the fact that this was an experiment that was done. Equal qualifications. They even bumped some of the Black business owners' qualifications up, and this is what the testers came out with.
Wow. So once again, this EDA, New Jersey Economic Development Authority, that's an important initiative that is in fact looking to help women, minority-owned businesses, veteran-owned businesses that have been impacted by the coronavirus and well beyond. Tara, as always, thank you for being with us. Thank you for educating us, inspiring us, and frankly, challenging us, because we must do better. We have to keep trying to do better and keep doing the work you're doing in the media. We see you nationally as well on MSNBC and other places. Tara, thank you so much.
Thank you.
I'm Steve Adubato.
Thank you for spotlighting, Steve.
Sorry for interrupting. Catch you next time, folks.
Also brought to you by the New Jersey Economic Development Authority, RWJ Barnabas Health, New Jersey Board of Public Utilities Clean Energy Program, the New Jersey Education Association, the Healthcare Foundation of New Jersey, the Fidelco Group, Johnson & Johnson, Georgian Court University, and by NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years.
You may not have heard of TAVR. Raj and Sandhya have. It's the minimally invasive alternative to open heart valve replacement. RWJ Barnabas Health is New Jersey's leading TAVR provider, and we continue to perfect it. Patients are often back to their lives in just a few days. Innovative valve replacement surgery, because you can't be replaced. RWJ Barnabas Health. Let's be healthy together.